Thank you very much, Chris. I'm really pleased to be here, and thank you very much to everyone for joining us. What we're hoping to do, over the next sort of 50 minutes or so is talk through some things to do with the involvement of people within systematic reviews. We're going to talk about an example that we did ourselves, and then we're going to move on and talk about the active project. And the emphasis in all of this is really going to be on the practical how to do involvement within reviews. So we're just going to start with some sort of welcome and introductions. Start by introducing myself. So as Chris has said, my name's Alex Pollock. I'm a Senior Research Fellow at Glasgow Caledonian University. The picture you see there is actually where I live. So while I work in Glasgow, I live several miles north of Glasgow, and that is pretty much the view from my office. Not looking at that just now, but that's the view I see on a daily basis. I've been involved doing Cochrane reviews for several years. I'm an author, I think now on 13 Cochrane reviews, and I'm an editor with the Cochrane Stroke Group. So that's sort of my brief background. You'll get to know a little bit more about me as we go on, but I've also in the office here got Pauline with me, so I'm just going to hand over to Pauline and let Pauline introduce herself.
Hi, good morning. I'm Pauline Campbell. I'm a research fellow at Glasgow Calais, working with Alex on this project, and also a Cochrane reviewer. And I don't have anything as glamorous as that beautiful view. The view I look at when I'm doing my reviews is my dog, Campbell, who's always wanting a walk. Anyway, it's lovely that you're able to join us this morning, and I look forward to learning from your experiences as much as what we're able to share with you.
Thanks, Pauline. So we were really quite keen just to get an idea of who it is that we've got listening as well. So as this is going to be an interactive session, we thought we would start off with a little bit of interactivity and ask you a couple of questions. So we're going to ask you to tell us who you are, how you would best describe yourself, and also why you're here, why you've decided to join this webinar just now. I'm going to hand back to Chris, who's going to do the bit to let you click to tell us the answers to those.
Righto, so you should all be able to see the poll. If people would like to, okay, yeah, I can see that people are completing that now. We'll just give it a few seconds for everybody to answer. Okay.
Okay, thanks, Chris. That's great. So I can see the response there. So we've got 59% of you reckon that you're researchers, and 23% editors, 23% authors, and some others. If you want to tell us what other you are, then please feel free to sort of use the chat function or the questions and let us know actually who you are. I think that's a really good and varied group, which is fantastic, and I think it demonstrates the variety of interest that we've got in this sort of topic, and it's, from my point of view as an author and a researcher, I would have ticked both those boxes. It's really nice to see the degree of interest that we've got from those two groups. So my plan now is to move on and give you an example of involvement. One of the reasons I'm going to start with this is it does tell you a little bit about me and why I've ended up getting involved doing public involvement, consumer involvement in my reviews. So what we're going to be talking about is a review that I was involved with, which was a review of physiotherapy for stroke. It was actually an update of a Cochrane review. The photo that you've got in front of you now shows a group of us, so myself plus some of the consumers and professionals who were involved as users in the review. And this is when we actually managed to have a jaunt out and we went down to the UK Cochrane meeting and talked about, or the users talked about their experiences of being involved. Today I'm going to give you a fairly brief overview of what it was we did, and it's really just to give you a flavour, an example of what we meant by active involvement. But if you do want more details about what we did, then Chris has uploaded a number of papers which give you more information. So you'll have, which you can look at the end, the full Cochrane review, which might be interested if you're interested in the topic, but perhaps more usefully, we had we've got a paper published in Systematic Reviews which gives you more details. We've also uploaded a couple of posters which hopefully are useful for those of you. Sorry, I've just had a message from Chris to say that I didn't talk about the why are you here poll. Really sorry, Chris, that was me wanting to rattle on. Do you want to just tell us the answers to that? Apologies, everyone.
No, it's okay. Alex, we can run that poll now if you'd like to run it. I can launch it. So this is the poll here, just asking people.
So this was, sorry everyone, I was obviously really keen to crack on, but yeah, we were just, as well as finding out who you are, we were wanting to find out why you wanted to join, and sorry, that was my fault entirely.
Thanks, Alex. So we've got...
Right, so we've had very quick...
Yeah, we've had a few...
Yeah.
Okay, yeah, and then here's the results.
Yeah, so about half of you are here because you want to involve consumers in your review, which is great. Another roughly half because you're curious about what we're doing, and a few of you because you want, as consumers, presumably, to get involved in a review. So sorry for jumping to that late. So back to where I was talking about our physio review, and I was just telling you that there are a number of things that Chris has uploaded to give you a bit of background. So as well as the sort of journal publications, we've also uploaded a couple of posters which are hopefully a way that you can get some information about what we did without having to do too much reading. So why did I decide to have people involved in this update of a review, especially considering that it was a review that had previously been done without any involvement of consumers? Well, really, during the previous versions of the review and the last update of the review, we had encountered all sorts of problems to do with how we were bringing the evidence together on this particular topic. And I knew that we had to find a solution to these problems in order to move forward and have a review that was useful, but I genuinely didn't know actually what the best solution was. And just by pure coincidence, at that time, I had actually just finished another project which was looking at generating research priorities from patients, carers and health professionals. And that project had a big impact on me in that it really demonstrated to me the value of properly involving people and involving people to the level where you're handing over some of the decision making and you're giving them control over the process. So we decided in terms of updating this Cochrane review of physio interventions at this time that we would do it, but that we would try and absolutely embed centrally to that update the involvement of stroke survivors, carers and physiotherapists. We decided just to involve physiotherapists as the professional group because that was the focus of that review. So what did we actually do in practical terms? Well, we started by planning and we wrote a detailed protocol. Now, this wasn't a protocol for our review methods because obviously we already had this because this was a review update, but it was a protocol for our methods of involvement. It sounds really obvious now, but actually I don't think it is that obvious, and I think it's very rare within a systematic review protocol to see people writing out how they plan to involve consumers, even if they do then involve consumers. And if I'm entirely honest about the reason we did that, the principal reason that we wrote a protocol was that we had to get grant funding to support our review update. And that act of writing a funding application forced us to think through in a huge amount of detail how we would involve people. So having that protocol was really valuable, and I think it was probably one of the key factors that made our project successful. Oh, have you lost me? No, sorry, I just lost my own screen there. Apologies, I haven't got my screen in front of me now. Chris, I might need to hand over. I've not got my slides in front of me now.
That's fine. I can run your slides from my page. That's
okay. So just okay. So staying on the current stats slide so yeah, so what I was saying is that we had a protocol and that we had a plan in detail. So really, if I was going to give any simple message to someone, it is that to plan in detail what you're going to do before you jump in and do it. At this beginning stage, we also applied for and got ethical approval. Now, there's a big question mark over whether you need to get ethical approval to involve people in research in terms of involvement. However, we planned to audio record our meetings, and we wanted to be able to use that data, effectively qualitative data, to support our projects and possibly within publications as well. So we felt that it was appropriate for our project to get ethical approval, and we did that through the university. Having done that, we then formed a group of people and ran a series of pre-planned group meetings. So I'll move on now and say a little bit more about each of those two stages. So in terms of forming the group, we didn't just open our office door and shout down the corridor and gather in our friends around us. We used a very structured and planned approach. If you just click now, please, Chris. So we started by creating a 2-page information leaflet which told people what they would have to do if they volunteered. It described the sort of people that we were looking for. It gave people some really specific details, such as the dates of all the meetings that they would be asked to attend if they were part of our group. We sent that leaflet out through our established networks. We had networks of stroke survivors, carers and physiotherapists. So as I've said, so that it was physiotherapists and not other health professionals. So if people were interested in taking part, we then asked us to contact us. And if they did contact us, if you just click again, please, Chris, we didn't just accept everyone onto our group. We used the sort of sampling techniques that you would use within qualitative research to purposely select a group that we hoped would be fairly representative. So we were aiming to have a group that would be roughly half stroke survivors and carers and half physiotherapists. For the physiotherapists, we looked specifically to have some who were in senior roles, some who were in much more junior roles. We looked to have some who were working in acute inpatient settings, some from rehabilitation settings, some from community settings, and also different sort of geographical locations. So we were aiming to have a group of between about 12 and 16 people, and we ended up recruiting 13 people onto our group. So the next slide, please, Chris. So moving on to actually what we did within our groups. If you just click again, please, Chris. So we held a series of pre-planned meetings, and each of those meetings had a very clear focus, and we decided in advance which decisions we would effectively hand over to the group and which things they could not change. So the first 2 meetings took place right at the beginning of the project when we were updating the review protocol, and then we had a meeting towards the end, the 3rd meeting, which was when we had some draft results. We were asking people to agree what they thought the key messages were from the results. And click again, please, Chris. So in all the meetings we used formal consensus making techniques, and this was based on something called the nominal group technique. In practice, what that meant was that each meeting we started and the group agreed some meeting rules. Now, this wasn't about us as facilitators imposing rules on us. We actually handed that over and we said to the group, well, you decide what the rules were. The group then were asked to discuss a specific topic or statement that we had pre-planned. So the way that this worked in practice, again, is our group decided that they should have, no person should be allowed to speak for more than 2 minutes at a time. And that really was useful in keeping things moving. It meant that nobody could dominate the discussion. And they'd also agreed that people should raise their hands if they wanted to break into the discussion. So after we had a series of a bit of discussion, again, we had pre-agreed the time for the discussion for each of our statements, so about 45 minutes maybe, depending on what the statement was. Then we stopped the discussion, everybody was silent, we handed out paper voting slips and we asked people to vote in silence. And as well as circling their response to their agreement with the statement, we also asked them to write their reasons for their vote. We then, in front of them, gathered in the votes. They were anonymous, but we gathered them in front of them and we counted out so that we could see the level of agreement with that statement. So we'll have the next slide, Chris. So just to show you again in practice how this worked, this was our statement that we had at the very first meeting, the very first statement. It won't mean much to you. The current categories are appropriate and clinically relevant, but we had sent people from the group information out prior to the meeting so they understood what these categories of interventions we were talking about. And at the beginning of the first meeting, we spent about 10 minutes presenting to them on what the categories were and why we felt that we were having difficulties with them. We then handed over the discussion to them, and they talked for about 45 minutes on this before we stopped and they voted. And you can see the results of their voting now, and you can see that really was consensus that they disagreed with that statement. So what that then meant was that at the next meeting, meeting 2, the group had to move on, and they had the responsibility of finding an alternative system for us categorising the intervention. And I haven't got time to go into details of everything we did in the second and the third meetings, but hopefully that's just given you a flavour of how we were really giving the group the control in terms of decision making, and their decisions did have a big impact in terms of what the final review looked like. The next slide, please, Chris. And if you just click again, thank you. So as well as having the 3 group meetings, we did also keep in touch with the members of the group throughout the review process. So this was often by email, but sometimes we also had telephone conversations. We asked people to comment on various drafts. We asked them if we had specific questions. And occasionally, we handed over decision making for a number of things. So to give you a real example, towards the end of the review, we had received the editorial comments on our review, and one of the comments was about the wording of our title. And there were a number of different alternatives to try and clarify the title of the review. So we just created a very simple online doodle poll, and we sent that out to all members of the group, and they very quickly voted anonymously, and we reached consensus on the new title in that way. At the end of the process, we did also carry out some evaluation, not evaluation of the impact of the involvement, but rather some evaluation of how people found our involvement. And the next slide, please. So in this slide, you see some of the statements that we got with in our evaluation from our discussion and from our questionnaire. Everything, as you might expect, as we had a group that was very involved by this time, was very positive. As I said, we didn't evaluate the impact. I can't tell you what I felt as an author and the impact on me as an author, and certainly everybody always says to me, oh, well, wasn't it very time consuming and wasn't it difficult? And actually it wasn't difficult, and I don't think it added much time onto the process. If anything, having these set meetings throughout the process kept us to our timelines more than I might have done otherwise, because there's nothing that makes you work harder than knowing you're about to have to present something the following day or the following week. The other advantage I felt as an author is it helped me reach decisions much quicker. I was clearer about what the decisions were, and in terms of writing the review, I felt there was a lot more validity in terms of the conclusions and the discussions. So yes, there was some organisation and some thinking required as an author in order to do this, but it did actually, in many ways, make some parts of the process easier. So moving on to the next slide then, that was the sort of end of my very brief description of that. I think this is probably quite a good time to stop and see if anybody's got any questions, and possibly at the same time we could just run this other poll. We thought we would use a little bit like we were using within our nominal group technique. We've got a statement here and we'll ask you what your level of agreement is. We can't unfortunately spend 45 minutes discussing it first, but if Chris can do that, then you can click to say what your agreement is.
Thanks, Alex. Yeah, the poll's live. I can see everybody's answering. Just give it a few seconds for people to answer. If anybody's got any questions, the question box down the bottom of your panel, do add any questions for Alex or for Pauline. Okay. So everybody's had a chance to vote in that poll. Let's just share those results.
Okay, thank you. So we've got 58% of you are saying you strongly agree, 35% agree, and 8% neither agreeing or disagreeing. So I'm really pleased that obviously there is consensus that there's a need for review authors to know more about how to involve people, and that's great because that's exactly what the active project about. So that